Okay, so we've got a brief, very end session, but we're going to give most of the time now to Curtis, who's come from Oregon. He's a histopathologist there. He runs one lab and he supports others, and he does academic stuff, particularly with nail and hair follicle. And he's a great collaborator with the Council for Nail Disorders and the European Nail Society, so we're very lucky to have him. And thanks very much for coming all this way. So over to you, Curtis.
Thank you. I actually was thinking of all these surgical lectures, which were really good. And, but I would like to do a study on whether the attendees are more likely or less likely to do nail surgery after coming to one of these meetings. So, and I like the cadaver with no blood as a pathologist. I want to start this lecture with words that I've been saying at every lecture of nails I've been giving for the last 10 to 15 years, and it's about how to submit tissue. And this is because pathologists hate nails as much as a lot of clinicians do, and it's because you get a rule out melanoma, and by the time the histo lab is done with trying to process hard nail and very soft, delicate nail bed and matrix biopsies, you can't even find the pigment that was seen clinically. So they live in fear of these specimens. And I want to talk a little bit about the most common nail lesions that I see, which are often not the ones we're talking about the most, and then if we have time, talk a little bit about updates on fungal identification, including mold. We have a lot of mold in Oregon. The climate's very similar to here.